Hi everybody, welcome back to Toothday Talk with me today. I'll try to be brief. Erica, the lady running the camera right there, has made a list of things for me. These are medical conditions that I can either, a lot of times I can see these, or I can diagnose them. Or if you have them, I really need to know about them. So I'll just kind of brush along some of these. Some people, I think, wonder why we have this huge medical history form when you come to the dentist, but you'd be surprised a lot of the medical conditions you may have or may not have are really important for us to know. A couple things on the top of the list that Erica has for me are acid reflux, eating disorders. So by eating disorders, that mainly means bulimia and how that ties into acid in your mouth, but more commonly, it's just acid reflux. A lot of people who have acid reflux, not gas, acid reflux. Oh boy, don't even realize it, but I can see it on your teeth. And many times that can be to the detriment of the teeth, but the main reason I'm trying to really look for that is because it's really bad for your esophagus. It causes esophageal cancer. So on the teeth, I'll see them, they kind of start to look like marbles because they just get really round from the acid. Whereas the wear in the teeth is going to be more angular, kind of a flat facet from the teeth rubbing together. Acid kind of makes them round. So if you're one of my patients, I pointed that out to you, you really know what I'm talking about. Dry mouth is an awful thing to have. Many people have it from medications and can really cause increased tooth decay because you don't have that saliva washing the acid off your teeth. The bacteria can grow wild in there. So I've seen people actually lose their teeth because of dry mouth and cavities that we just can't get under control. Diabetes, very important. I'm going to need to know about that. If you need an extraction, any type of surgical procedure, you might get a little slower. So I may prescribe medications differently. I may choose to, for example, if you need to lose a lot of teeth, I may choose to do a few at a time versus a bunch. It really depends on how healthy you are. Osteoporosis makes the list there too. Osteoporosis in and of itself isn't too big of a concern with tooth extractions, but the medications that people take for osteoporosis can impede healing sometimes. It's a rare thing, but it's important to know about when that happens. Medications like Fosamax, bisphosphonates is what they're called. Clenching and grinding is a big one, really big one. For some reason, people tend to really want to resist this. If we tell them we really think you're clenching or grinding, some people, you may have done it in the past, it may be current, but it is really important to know if you're doing that because at night you will surpass your own pain threshold, grind your teeth like crazy. So please be open to talking to us if we talk about clenching and grinding. Pregnancy, I need to know about that, obviously, depending on how many get you numb, can cause some inflammation in the gums. So I need to know about that. I can see also nail biting, thumb sucking. Kids do these things, adults with the nail biting, nothing to be ashamed of, but I need to know about that so that I can help you. Sinus infections can cause the teeth to hurt. I see people come in sometimes thinking they've got a toothache, and it's from their sinuses, and I can see that. Some cysts, oh my goodness. I just had a patient with an enormous cyst that I happened to find incidentally on the x-rays. Again, that goes back to why x-rays are important. He had a huge cyst in his front teeth. It was not symptomatic. Had I not found it, he could potentially lose his teeth to that front teeth. Kind of a big deal. Alcoholics, you tend to have dry mouth, impeded healing. Oral cancer, we're looking for that when you come in for your checkups. Believe it or not, we're going to be the ones that catch that. A stroke. I had a patient come in one time with kind of some sagging on their face and wondering what was going on, and we sent them to the doctor right away for a stroke. Sleep apnea ties into grinding. Believe it or not, most people who have sleep apnea are going to be grinding their teeth. That's important, and sometimes I can look at a person and ask if they have sleep apnea and wonder how I know, but I'll also catch it when I sedate them because I see them sleeping. Sleep apnea is really dangerous for your health. Something to know about. I can kind of get into the bottom of the list here, but yeast infections in the mouth, like a thrush, I can treat that. I'll see that. Actually just did today. Tied in with dry mouth or other maybe autoimmune diseases can be a big thing. So your health history too. Another time I had a patient come in who She ended up having a seizure in my office. It was really scary. But because of her thorough health history, I was able to then tell the EMTs who came, she does have a history of seizures. So there's all those medical conditions that I do need to know about so that I can treat you more appropriately. And even in a small town, of course, that's privacy protected. People won't worry maybe about telling me about those things, but they're all just human things, and the reason that we ask for those is so that we can make sure that we treat you as good as we can. So that's my talk for today. Go ahead and comment with any questions. Thanks.